Okay, so I'm back. PCS practice, start to finish. I had to break the videos up because I have to break the videos up because my son, when he wakes up, it's he needs me for too long for me to uh, walk away from the video and have you guys just looking at a wall. So when he wakes up, then I have to cut the video off and just start another one. Oh, I'm fat. But anyway, that's another story. So, I said I was going to let the CE know that I was done, but before I do, I want to jot a few notes in my box. So, for my 20-minute check, I want to put P for parental, D for drainage, O for oxygen, E for encouraged fluids. For pain and comfort, I want to put my mnemonics for comfort, and I say comfort will last for how long. So will last is WL. So I know that's I ask the patient what makes you comfortable, what do you do to get comfortable, and then I'll ask the level of comfort. That's all for the assessment with that. And then with fluid, MT, it's maintain fluids. So I remember fluids, maintain fluids. So MT would be, the M is for the mucous membranes, the T is for tugger. Encourage fluids, tap water. I remember the encourage fluids, and that's for the type of fluid, amount of fluid, and the patient's respond. Muscular skeletal, SIR, FB for short for full body, and PART, PART. So the SIR is the score and the risk as far as the fall. The F is for, once again, the fall risk. The B is for keeping the patient in body alignment. The P is for positioning the patient. The A is for if I have to apply any heat or cold. The R is for range of motion. And the T is for any therapeutic devices. And then my wound, I have PM ADT. ADT is a security system company. And I pick PM because I know most robberies or break-ins happen at night. So PM ADT. And I put that with wound because if someone is at the house and they want to protect themselves, have a gun or whatever, or don't have anything to protect themselves, then within a robbery, in some cases, somebody could suffer a wound or whatnot. So wound is PM ADT, and my PM stands for asking if they have pain, and the method that I use as far as the numeric scale, 0 to 10. The A is for the appearance of the wound bed and surrounding edges. The D is for if it has any drainage. And the T is for the type of wound. And then safety is, like I said, SCAB, SCAB. And S is for side rails, C is for call light, A is for you need anything else, B is for, he is trying to wake up again, B is for the bed, low and locked. I have to figure out, and I'll let you guys know in the next video, I meant to write her name down, whose grid that I liked it the best and wanted to go with. And this is her mnemonic, the scab. I like that. And also, I'm going to put my mnemonics that I have. Hers was kiwi. And that's why I don't like use other people's mnemonics, because you really don't remember. Oh, knock, wash your hands, introduce, and explain what you're going to do. That's what's hers. Mine is, great was Sharice's party in East Point. I earled something. I earled up rose something nasty. And my G is for greet. My W is for wash hands. My S is like always checking for safety around the room when I walk in. My P is for privacy. My I is for identify the patient. My E is for educate. No, not this E. This E is for explain what I'm going to do. My P is for ask if they are in any pain. My I is for my interventions. My E is for educate. My U is for patient understanding. My R is for reassess. My S is for safety. And my N is for needs, if they need anything else. And then I just have that in my first box or my note or at the top somewhere. But as long as I got scab here, I'm good with the end. And the beginning, greet, wash your hands, safety, those things. Those should come to me like nothing. So that's that. So now I will hand this to, I will go get my C and let her know that I am ready to move forward. Hi, I'm ready to move forward.
Your PC assignment, her name is Ramona Rojas. Her diet is no concentrated sweets. Her activity order is bed rest and must use the bedpan. Side rails up ×2 at all times. She has a history of fall in the last 3 months. She's allergic to sulfur. You have been assigned comfort management, cold pack to surgical area 15 minutes one time during PCS. You have been assigned fluid management, record the intake, output, drainage, Jackson Pratt, parental IV solution, lactate ringers. You have been assigned oral fluids, encourage oral fluids. The lactate ringer has a flow rate of 125 milliliters an hour. Infusion controlled device. Medication administration, CMIR. You have been assigned musculoskeletal management of the lower extremities. The activity, position the patient, reposition in bed once during PCS. Activity assistant, range of motion, feet and ankles. Let's see here. You have been assigned wound management. Cleanse the pen site with 0.9 sodium chloride on a sterile cotton tip applicator. And I will now give you the verbal handoff report for Ramona Rojas. So here's the scenario. Ramona Rojas is a 20-year-old college student who was riding her bicycle to class when she hit a pothole, causing her to lose control of the bicycle, run off the road, and fall. She was not critically injured but sustained an open left femur fracture and a concussion. She was admitted to the hospital for open reduction, external fixation surgery, and observation. Background: Ms. Rojas is a single and a full-time college sophomore. She has a history of type 1 diabetes mellitus since age 12 with good self-management. Her comfort management: patient reports discomfort from the external fixator device, saying that it rubs her leg when she moves in the bed. Verbal comfort scale is reported as 3 out of 10. She also reports itching at the pen sites. Patient states when she is repositioned in bed, her comfort is improved. Fluid management: oral mucous membrane moist, skin, non-tenting of the clavicle. Patient has not been taking in much oral fluids because she disliked using the bedpan. She should be encouraged to drink liquids. Patient has a Jackson-Pratt drain in the left upper leg, draining small amount of serosanguineous drainage. Drain is secure to leg. Drain site intact. Surrounding skin slightly reddened. No edema with small amounts of crusted materials around drainage entry site. Patient receiving lactate ringers in right forearm. Intravenous at a rate of 125 milliliters an hour. No redness or swelling at the IV site. Medications: patient has type 1 diabetes mellitus since age 12. She takes insulin based on sliding scale per her finger stick. She takes birth control pills to regulate her menstrual cycle, and she's receiving antibiotics and pain medication. Musculoskeletal management: patient has an external fixation device on her left leg and is on bed rest. She uses a bedpan currently. Left leg is swollen and bruised. Patient is unable to move left leg by herself. Right leg is warm to touch, pink in color, no atrophy, no edema, strong with full range of motion. Flexion, extension performed times 3 on left and right ankle. Patient needed two persons to reposition in the bed. No report of pain with positioning. She is encouraged to perform foot and ankle exercises to help prevent deep vein thrombosis. Morse fall scale 60, high risk, fall prevention. 2 side rails up at all times. Car bell in reach. Wound management: pen site is to left upper leg, slightly crusted and reddened with a small amount of serosanguineous drainage. No odor noted. The pen sites are cleansed every shift with 0.9% sodium chloride on sterile cotton tip applicator. Patient states pain at 5 out of 10 on a numeric rating scale. Receiving hydrocodone with acetaminophen prior to dressing change. Others: her finger stick blood glucose level has been running a little high since the bicycle accident. Last glucose reading was 160. Her vital signs: last taken 2 hours ago. Temperature 98.2. Pulse 88. Radar. Respirations 18. Blood pressure 122/78 in right arm. O2 saturation 98%. Room air. Pain level 4 on a numeric grading scale 0 to 10.
Okay, so what I did is a little different probably than anybody else do. I clustered my information that she gave me on in the boxes with my, like if it was something about comfort, I put it in the comfort box. Anything she said if it was muscular skeletal, I put it in that box. Like I just put everything in the box. So that's that. So now I believe this is when I do the care plan. Let me see. What did I put for that? Okay, so I didn't put anything, I didn't do a recording. I thought I did, but I guess I didn't. So, this is the time where you would do your care plan and finish off your notes or your grid. So based on the information that she gave me, I can do a care plan. I'll go ahead and fill in my medications, what they're for. So she has hydrocodone for the leg pain, tissue trauma, for her wound. So, and I'm gonna verify when I have my next phone call from the faculty, Excelsior faculty. Can I put wound for leg pain or tissue trauma, or do I have to put surgical for surgery? What exactly, does it matter? The cephalexin, of course, is an antibiotic. I'm assuming it's a prophylactic to prevent an infection. So do I put that, or do I put tissue trauma? And then the norethindrone, I looked that up and I seen that was for controlling bleeding, but in the report I got, it's for her menstrual. So I'll change that to menstrual. Birth control. Okay. So that's that. So now I'll go to the care plan, if he allows me. Let me see if he'll take a pacifier right now. Sometimes I have a patient over here. I have another patient. His name is Aiden. So I'll be right back. See if he would take a pacifier for comfort management. All these pacifiers they have here at the hospital, and all of a sudden, it's hard for me to, I got one. Okay, hold on. Hello, baby Aiden. Here's a pacifier. Here you go. Okay, so he's all set. Usually he doesn't take a pacifier, so we'll see how long that'll last. Okay, for the care plan, of course, I already did the care plan, but just some things that I picked out of the report. Um, Pain level 5 out of 10. She's not been drinking her fluids because she doesn't want to use the bedpan. She has discomfort. The external fixator rubs against her leg with movement, which is uncomfortable. She has itching at the pen site. She said repositioning helps her, improves her comfort level. Her comfort is 3 out of 10. She's on bed rest. She's a 60 high risk fall, a 2-person assist. Her side rails is to be up. She uses a bedpan. She has an external fixator. She has a Jackson Pratt on her drainage. So the NANDA nursing diagnosis that I came up with was impaired bed mobility, ineffective physical mobility, impaired comfort, and impaired walking. Well, impaired walking wouldn't be one because she can't even walk. So using my nursing judgment to arrive at a priority nursing diagnosis to make sure there is data to support the decision. I would say impaired comfort is what I would go with, because she has this big external fixator on her upper leg, and she's in bed rest. Have to use a bedpan. She states that it's uncomfortable. So I would use impaired comfort. I'm going to put the pacifier back in Aiden's mouth. Somehow he got it and put it back in his mouth. Okay. And then the considered teamwork opportunities. The UAP can help with repositioning. The LPN can apply the cold pack, and the LPN also can cleanse the pen site. Now this is just a data collection and analysis worksheet, and it's optional. You don't have to fill this out, but it helps with creating a care plan. So you get a half an hour for this. So my assessment: patient states the number 1, she needs 2 for the plan of care. Patient states the external fixator rubs against leg during movement and it is uncomfortable. Number 2, patient states her comfort level is at a 5 out of 10 and she itches at the pen surgical site, and at the surgical site. Nursing, my NANDA 1 nursing diagnosis is impaired comfort. The rationale for this selected nursing diagnosis: patient has experienced physical discomfort at pen site. If not improved, patient will be less likely to assist in care. I got a little help from that, from the care plan that was already filled out online on a Excelsior website, in which I got the PCS from. And I don't know why I didn't understand what it was saying, rationale for the selected nurse's diagnoses, but I was like kind of confused, so I looked at it and it made sense, so I used it. Related factor, I put that the external fixator, and then it had to have an open reduction surgery. And then when I looked at the sample of the PCS, they put tissue trauma, just simply tissue trauma. Expected patient outcome, I put patient will state she is comfortable, 7 or higher on a 0 to 10 comfort verbal rating scale by end of PCS. Nursing intervention, reposition patient in bed. Rationale, repositioning patient will improve comfort by releasing pressure. I don't know. I probably have to put more with that. I don't know if that's enough or not, but I'll ask when I have my faculty call next week, I'll ask them. If I had to add more, I would say by releasing pressure off the bony prominences. 2, apply ice pack to pin site. Rationale, the cold from ice pack will help to relieve itching. It will also, this is what the example said, it's a local anesthesia, and it will promote a therapeutic effect. Simple, that's what they said. So I'm going to find out if what I said is good enough too. The cold from the ice pack will help to relieve itching. So that's my care plan. And I am ready to go. So I would take, I guess I should have showed you guys the packet real quick. The front that you have to fill out with your name, clinical examiner's name, examination test site, the date, and the number PCS, which one, 1, 2, or 3. It has the flat pain rating scale and the FACES pain rating scale. This in your packet. Numeric rating scale, comfort verbal rating scale, and comfort DAISY scale. This will all be in your packet, so you don't have to try to memorize this. The Morris Fall. And the Braden scale for pressure sores. That's in the packet. And it's just another comfort drink. I had to use both sides or whatnot. So, and then in the rest of this packet is just places for you to document. It has the fluid sheet. It tell you everything you have to put, where to fill it in. And then you can put notes at the bottom. And then the rest of this is just where you chart. So this is neurological assessment, muscular skeletal management, and that's all. Is all of the management that's in here, and that's where you would chart. And then has vital signs. A place where you will actually document your vital signs. You put your vital signs. And then the rest is just for notes. So I will let her know that I am ready. The pacifier put Aiden to sleep. Surprisingly, that means he just was not ready to get up. He just wanted to bother me. He wanted his mommy. So let's go find her and let her know that I am ready.
When you have your PCS assignment and documentation form, this indicates that you have completed all the requirements for the initial plan of care and are now ready to enter implementation. Are you ready for me to review your initial plan of care?
Yes.
Okay. You have met the critical elements for the initial plan of care and are now ready to enter implementation. All critical elements for the PCS are in effect. My role is a silent observer, but you may ask me questions that are not of a teaching nature. If you need me to assist you, you must verbalize that request to me and instruct me on what to do. Should you decide to revise your initial plan of care, inform me of your intent and document the changes on the plan of care form. Once you've documented the revision, hand me your plan of care form for review.
Okay.
20 minutes after the implementation start time, I will be reviewing the PCS assignment and documentation form for any critical elements required to be documented within 20 minutes.
Okay.
The implementation start time is 8 a.m. You may begin.
I'm gonna pause here in this video, see to my son, and then I'll do part 3, and that's implementation phase, the nitty-gritty, 20-minute checks and everything else that goes with that. I'm excited about that part. All right, see you guys.